Carotid artery stenosis refers to narrowing of the carotid artery. The carotid artery is the artery you can feel right under your jaw here, and it is a main artery to the brain. Carotid artery stenosis means narrowing of the artery, which is caused by buildup of plaque in the wall of the artery. The reason we care about carotid artery stenosis is because it is a very important cause of stroke. Carotid artery stenosis or carotid artery blockage can cause stroke in one of two ways. The first way is that if the artery blocks off completely and there is an inadequate amount of blood flow going to the brain, the patient can have a stroke. The second way, which is actually more common, is that blood clot or debris that is formed on the blockage may break off and travel up to the brain and cause a stroke. You'll want to discuss with your doctor what medications you need to be on to treat your carotid artery blockage. Generally speaking, some type of medication to prevent blood clot from forming is usually necessary. Most patients are placed on drugs like aspirin or other drugs like clopidogrel or Plavix to prevent blood clots from forming. Also, it's very important to treat your other risk factors for vascular disease. Very important that you manage your blood pressure, your cholesterol, and if you have it, diabetes appropriately in order to lower your risk not just for stroke, but for heart attack as well. There are two surgical treatments for carotid artery stenosis. The first, which will be further discussed by my colleague Dr. Adam Arthur, is carotid endarterectomy. In that procedure, an incision is made on the side of the neck, the artery is opened, and the plaque is removed. The second procedure, carotid artery stenting, is a minimally invasive procedure where a stent or tube is placed up through the artery across the blockage and used to open the artery from the inside rather than using an open surgical approach. Your doctor may recommend carotid artery stenting or carotid endarterectomy for one of two reasons. The first is that you're having symptoms of stroke. You've either had a minor stroke or you're having transient symptoms of stroke or temporary symptoms of stroke, and the doctor is concerned that you're at high risk for having stroke. In that case, it's very often necessary to have the procedure to lower your risk of having stroke in the future. Sometimes patients are found to have a carotid artery blockage who are not having any symptoms of stroke. In that case, you will want to have a conversation with your doctor about your options, which would include continuing to treat your blockage with just medicine. The risk of having a stroke if you're not having symptoms is actually quite low, and only some patients would really benefit from having surgery versus just being on medicine alone. The goal of carotid artery stenting and carotid endarterectomy is exactly the same, which is to prevent you from having a stroke. The procedures are similar but have some important differences. You'll want to discuss with your doctor both options. For some patients, a carotid endarterectomy is a better procedure. For some patients, a carotid artery stent is a better procedure. And for some patients, either option is good. You'll want to discuss your specific situation with your doctor. Carotid artery stent procedures are usually done with little or no sedation, so you will be awake during your procedure. The procedure is not painful. Carotid artery stent procedure begins like most angiography procedures with placement of a small tube into the artery in the leg. Your doctor will administer a numbing medication to numb the skin prior to doing this so it's not painful. During the procedure, you won't feel the catheters being placed up into the neck because you don't have any feeling on the inside of the blood vessels. What you will feel is when the X-ray dye is injected to take a picture of the artery. You'll experience a warm sensation in the side of the face. Some patients get a metallic taste in the mouth, and some patients may see flashing lights behind the eye. These are all normal sensations caused by the X-ray dye and are temporary. They're generally unusual, but they're not painful or unpleasant. During the procedure to place the stent itself, you may experience some pressure under the side of the jaw or an ache in the jaw as the stent or balloon is opening the artery. That is also usually a very temporary sensation, and again, a little unusual but not painful. After the procedure is done, your doctor will need to hold pressure on the place where the tube was placed into the artery, and you should expect to be on bed rest for several hours after the procedure.
If you're diagnosed with narrowing or stenosis of the carotid artery, one option is to have an open surgery called a carotid endarterectomy to fix the artery and ensure that blood flow to the brain through that artery is not impeded or obstructed in any way. With that surgery, often patients are asleep, although in some centers the procedure is done under a conscious sedation protocol where the patients may be lightly sedated but mostly awake. The incision is made on the neck, and the surgery usually takes 1 to 4 hours depending on the difficulty in accessing the narrowing in your particular carotid artery. Patients often have some soreness after the surgery, but usually they're able to go home the day after the procedure or within a day or two.